October, a great time to be thinking about the business that you've done over the past year, the performance and successes you've had. Also a good time to start thinking about what's going to be happening in your business in 2016. And when you're thinking about those goals and objectives and those challenges that you have, you're also thinking about budgets. And when you're thinking about budgets, if you're a small business owner, healthcare costs are a big part of that. As we look ahead to 2016, we're excited at some of the options that we'll begin to be able to lay out for you for your insurance needs for your small business. But let's talk about what we've seen happening in the market and what we expect to happen over the next year or so. Over the last few years, as the implementation of the Affordable Care Act has happened, we've seen many small business owners have to make tough decisions about what they do with their insurance. If you're a small business owner with no employees, it's likely you've had to move into the individual market, into an ACA plan, because that's what the law required you to do. And so for you, you've seen some changes in your insurance, but hopefully still a high-quality offering and a high-quality product that you can use to meet your needs. If you're a small business owner who is on a grandfathered plan, that's the plan that you had before 2010. We've kept those plans out there for you, and we've seen pretty good performance in those plans. You can stay in those plans as long as we continue to offer them. And for the foreseeable future, we think that will continue to be an opportunity for you to maintain the same kind of high-quality coverage you've had at very competitive prices. If you renewed your plan in 2013 prior to the ACA, and you weren't in the same plan that you were in 2010, you didn't qualify for a grandfathered plan, you're probably in a transitional plan or a grandmothered plan. These are plans that were able to be extended through the end of 2016 until your renewal at that time. For many of you in these grandmothered plans, you're going to need to move into the Affordable Care Act plans at the end of 2016 and into your 2017 renewal, unless something happens with the law, an extension or a change, which is always likely. If you're an employer with 51 to 100 employees, you also were likely thinking about a move into the ACA small group structure at the end of this year. But with a recent change in legislation that literally happened last week, that won't occur now and it won't occur going forward. Basically, the law has changed to say that if you're under 50 employees, or if you're over 50 employees, 51 to 100, you won't have to move into the small group market, and the small group rules won't apply to you. So a lot going on in the health insurance space to think about. Know that we're here to help you figure out what your options are and how to help you move forward.